Good day, everyone. I'm Ivan, the moderator for this webinar. I welcome everyone to today's webinar, which is Mastering CCM, Best Practices for Patient Engagement, Workflow Efficiency, and Maximizing Reimbursement. I would like to introduce our presenter for today, Dr. Irina Koyfman. Dr. Irina is a nurse practitioner and a doctor of nursing practice with 25 years of nursing and 15 years of executive experience. Dr. Irina is a subject matter expert in chronic care management, CCM, remote patient monitoring, RPM, and care coordination, making her a frequent presenter at multiple conferences. I would now like to hand over the floor to the speaker. Over to you, Dr. Irina.
Hi, thank you so much, Ivan. Welcome, everybody. So today we'll talk a lot about chronic care management, and hopefully I'll be able to help you feel better about your work and your compliance and hopefully more reimbursement. Today we'll talk chronic care management. We'll examine the scope of services that are required to bill Medicare for CCM. We'll really go deeply into patient engagement, will identify efficient workflow and strategies. And really, I designed this to help you be better at what you do. Medicare, or Center for Medicare Medicaid Services, CMS, introduced very first chronic care management CPT code, which was 99490. It still remains that code for 20 minutes of kind of care management of patients per month. But in 2017, they added other codes. CCM is for two or more chronic condition, and principal care management is for one chronic condition. And then the biggest thing that happened in 2022, Medicare increased fee schedule by 50%. And in 2024, last year, Medicare introduced other programs. And this year, Medicare came up with something that it's called Advanced Primary Care Model. So what is chronic care management? Chronic care management is really the care coordination and care management that is happening outside of regular office visits, different activities that can and should be counted as chronic care management activities. So I'm sure you guys know that in order to qualify for CCM, patient has to have two or more chronic diseases that are expected to last at least 12 months or until the patient's death. On the provider side, there is a lot more, and I do want to go over that because there's now Medicare is doing a lot more audits on CCM, and compliance is important. And the initiating visit, what kind of visits could it be? It could be any type of E&M visit, evaluation or management visit, or annual wellness visit, or initial preventative physical exam, IPPE. Consent, when CCM began, it was only written consent. Now, care plan. Care plan has to be for all healthcare conditions. A comprehensive care plan must have all healthcare issues that are, that patient has. Revise when needed. So revise when, patient has a new diagnosis or they just got maybe severe, pneumonia and they got sick. It's not chronic disease, but you definitely wanted to edit your care plan. CCM compliance. You have to have a really good verbal but documented consent. So you have to have a prompt sharing and using patient health information. So my tip for success is to come up with the standardized checklist or workflow to ensure that everything is done and you can bill. So billing, just very briefly, people that can bill for CCM are physicians or non-physician practitioners who cannot bill, even though these people are considered non-physician practitioners, and podiatrists are physicians. However, and they can bill for E&M visit. Who cannot bill for CCM is clinical psychologist, podiatrist, or dentist. Big problem, I think, that majority, probably 99% of CCM is delegated to clinical staff. The definitions come from either CPT codes or CMS. And so I'm providing you both. CPT said a clinical staff member is a person who works under the supervision of a physician. Medicare said a clinical staff is an individual acting under supervision of physicians, so pretty much the same. So according to Nixon Law Group, right now, scrutiny is placed on the licensure and scope of practice of clinical staff providing services. So compliance questions. Can CCM be provided by physician or non-physician practitioners? Medicare is very, very strict, and they're saying no. Can you bill 99490 20 minutes without a conversation with the patient? So the answer, that is yes. Can you have third party doing your CCM? Yes, absolutely. Many great third parties are doing CCM services. Can CCM services be completely delegated to clinical staff? That Medicare saying that no. Do you have to assign each patient to a care team? Yes, providing continuity of care for the patient through a designated care team member with whom the patient has scheduled appointments. Barriers, I think, that I see is patient engagement. For every interaction, you have to start with education, personalized communication, build relationship through continuity, use multi-channel engagement, so, celebrate small wins, bring value to every call. And what are the strategies you can provide for that patient to feel better? And I want to thank you so much for being here with me and giving me your time. There's references for your for you if you like to see them. And again, I just want to thank you so much for being here and giving me your time. And hopefully you got some value out of it. Thank you so much. Guys, I can tell you that what I'm seeing is there's going to be a lot more scrutiny and a lot more audits from Medicare. So just be mindful of everything that I said. But I also see that CCM is going strong and is going to continue to be, going strong, well reimbursed. So, don't wait too long, jump on the bandwagon. And as APCM will start taking maybe place, front and center, we'll do more webinars on APCM so you can see whether or not you want to switch to APCM. But for right now, I think chronic care management is really the way to go. So thank you for everything that you do, and I wish you good luck.
Thank you, Dr. Irina. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and you may all have a great day. Bye bye.
Thank you. Bye-bye.